learning to master and utilize what we call the hip hinge. Now, if you look from the side, most of us, when we go to bend or reach for something, we bend straight at our back. Come on up. Not that that's a problem, we're meant to bend, but if you already have back pain with bending or sitting, and then you have to bend to pick the clothes up from the floor, or bend to tie your shoes, you want to give your body a different option than maybe hinging at the spine. You want to try to hinge or bend at the hips and the knees. So, face the front. The hip hinge is basically, there's two ways you can do it. You can put your hands on your hips, and then almost like you're getting down in a ready position, like a baseball player. Stand to the side, come on up. Okay, go again. Come on up. Another way to practice it is if you have a piece of PVC or a broomstick, working on getting your head, mid-back, and the top of your hips aligned with the broomstick or the PVC pipe, and working on bending at the hips first. Come on, keep your knees straight. Bend at the hips, and then bend at the knees as you're sitting backwards. So you can see you can actually move a good amount and a good distance without doing that. Now as soon as you go to move, come on up, bend, and this comes up, you can see that's how much movement or flexion that you have in your low back. Come on up, versus do the hip hinge. Moving like that, you're not moving at the low back, you're not straining the back. So again, it's not that doing that is better than the other, and one way is doing it better than the other, but we know that patients in pain need a different way to move, and it does take the stress and strain off already an irritated low back. So once you kind of master it, either using that baseball player type position or utilizing the broomstick, and you get good at it, you start implementing that in your everyday life.